Hi, this is John Rosenberg, the CEO of Hebrew Public. I want to welcome all of our attendees tonight for joining us for tonight's session. And I'm just going to sit silently here for about 10 or 20 seconds because I see we have a lot of people logging on now that we've opened it up. And I see a lot of familiar names joining us tonight. Parents and guardians of children from our schools, staff members, colleagues of ours from the schools and from the network. So I want to welcome you all. Thank you for joining us. And we're just going to please bear with us just for another minute or so we have the opportunity for more people to sign on, make sure that they're connected and ready to go. Okay, so just quick introduction, and I want to make a few opening remarks before we move on with the rest of tonight's presentation. This is a combination of a presentation and then a Q&A session that will run for a total of an hour. We are really thrilled to have two terrific folks here presenting tonight, Drs. Hill and Kosoko. My colleague Joey Rotter will be introducing them in just a moment or two. But I want to sort of set the table for their presentation and for this conversation. As those of you who've heard me talk about this before in town halls and in other meetings, it's been a horrible year. And we know how much loss there's been. We know how much fear there's been. We know how your families and children have had a hard time. And we've all had a hard time. We've all had losses and challenges. And so holding together as a community is really important. A lot of our role at Hebrew Public has been not only to act as educators, but to help guide public health decisions around our schools, which has been an unusual thing for us to do. In the course of doing that, we've really been driven by our values, including looking at data and looking at information dispassionately and trying to look for things that are accurate and discern truth from fiction. And so my big message today, as we continue to deal with this pandemic as a community here in New York, is if and when you can, get vaccinated. There's been a lot of misinformation about these vaccines. You'll hear from Drs. Hill and Kosoko about that. The vaccines are safe. The risks of the vaccines are so small and so infrequent that when weighed against the costs of not getting vaccinated in terms of your safety, your family's safety, and the safety of the community, it is not even a close call. I've gotten vaccinated. I was lucky enough to be able to do that as an educator. My wife, who's a clinical social worker, got vaccinated. Many of our staff have gotten vaccinated, and we know many members of the community have. And just to give you a sense of the status here in New York, the coronavirus data is still quite terrible here in New York. Infection rates continue to be high. The number of new cases on a daily basis has plateaued, meaning it continues to be quite high after coming down for a bit. It's now sort of holding steady. And so we're not out of the woods, and we won't get out of the woods until more and more people are vaccinated. In addition, the categories of people who are now eligible for the vaccine have increased substantially. Categories 1A and 1B are both open now. And I want to just give you just a little bit of a sense of some of the categories of folks who that includes. Anyone age 50 or older is now eligible to get vaccinated. All frontline workers, emergency workers, education workers, college faculty, people who work in mass transit, medical staff, and it goes on and on. Restaurant employees. You can find these kinds of data, and Joey, maybe you can drop this into the chat function, or we can follow up with this at covid19vaccine.health.ny.gov. And the really hope here is that as the additional weeks and months go by, more and more people will be able to access those vaccines. So without further ado, let me hand it over to Joey to introduce our two terrific presenters.
Thank you for that, John. And again, thank you to everyone for being here. I have the honor of introducing our two wonderful guests. First, we have Dr. Mandy Hill. Dr. Mandy Hill is established as a dedicated and resilient public health practitioner whose core mission is to improve health by empowering the decision-making capacity of vulnerable populations and racial and ethnic minorities. Through this central theme, she establishes behavioral interventions to empower communities. By establishing relationships and sharing knowledge while developing and implementing programs, Mandy touches a broad cross-section of the population to restore their power and sense of self. So thank you, Dr. Hill, for being here today. We also have Dr. Adiola Kosoko. Dr. Kosoko is a dual board certified physician in emergency medicine and pediatric emergency medicine. She is also trained in global health and spends time researching and collaborating with international partners. She currently clinically treats big kids and little adults ages 0 to 110 in Houston, Texas, and especially finds joy in medical education. Thank you so much for being here today, Dr. Kosoko. So as John mentioned, the general format of this will be presentation-based for the first half, and then we will transition into a question and answer portion. If you have questions, please go ahead and enter them into the chat. We will do our best to get to as many questions as possible. Please keep those questions geared towards the vaccine and COVID. Any questions about Hebrew public specific policies and the measures taken by the school, you can direct those to your school's main office or always the info@hebrewpublic.org email address, and we'll make sure that someone follows up with you. Without any further ado, I'm going to hand it over to Dr. Kosoko, who's going to start us off with the presentation.
All right, it's great to be here. And we really want to thank you all for having us to share some things today. We'll just start off with a brief introduction into the topic at hand, talking about COVID-19 vaccine and overcoming vaccination hesitancy. So as mentioned, my name is Dr. Adiola Kosoko. I practice emergency medicine. I treat children, I treat adults, 50% of my time on each. I also spend time doing international medicine as well. So the first thing I'd like to start off with are the basics of germ theory and immunizations in general. And how do we even get infected with things? Because we tend to use a lot of these words, but I'm going to try to break it down a little bit more basically. So whenever we have a bug, we can use that very broadly for any virus, any bacteria, any fungus, or any parasite, any bug. Our body can be exposed to this, and the general response of our body is to say, wait a minute, I've never seen this before. My keys aren't working. The things that I usually do to fight these type of weird things aren't working. But if I only had the time, I know that I could make the right keys to fight this thing, this bug. What we do know is that people who are chronically ill, those who are immunocompromised, that includes HIV/AIDS, those who are on chemotherapy, the elderly, those who have comorbidities, and that includes anything from hypertension to asthma to COPD to end-stage renal disease. They have the propensity to be more easily taken over because they need much more of this time to create these fighters. They need more resources. They need to be able, they lack some of the ability to make these keys. What we do know is that the people who tend to get better, they eventually develop enough of these keys, enough of these weapons, enough of these tools to fight the bugs. Unfortunately, the people who get very sick or who die don't develop these tools fast enough. And that's the basis of vaccinations. So, those who were around in the 90s, remember when we mapped the human genome. It was a huge deal because no one's ever done this in human history before, to know what is the essence of what makes things things, what makes humans humans. And that's DNA. That is your genetic material. That is what you are born with. And that is those are things that at this point in human technology, we do not have any ability to change. it would be the world's greatest news if we knew how to change DNA, because if we could change DNA, we could prevent disease. We could prevent the heart disease. We could prevent the asthma. We could prevent the cancer. We don't know how to do that yet. But the DNA is important is because our DNA creates blueprints as to how do we create things like skin and hair and eyes? How do we create children? How do we create our organs? It gives us a blueprint, but in of itself, it's a subject that we haven't been able to tap just yet. So it's in red because we don't know how to do that yet. But what we do know is that DNA leads to RNA. RNA is like the machinery that then produces the parts of the human body. It helps produce ultimately proteins, as we'll see here. The proteins that we care the most about when it comes to fighting disease are called antibodies. So they're essentially a type of protein. So a term that you've probably been hearing a lot in the news is the term RNA. RNA is very different than DNA. DNA makes RNA. RNA cannot make DNA, and it cannot alter DNA. The reason why you've been hearing the term RNA, specifically mRNA, is because two of the vaccines, the Moderna vaccine and the Pfizer vaccine, are essentially mRNA vaccines. We're introducing this into the human body so that your own body can create its own antibodies, proteins. This is new. We've had the technology for a few years. This is the first time we have been widely distributing this technology. So understandably, there's a lot of hesitancy to say, why is everyone talking about it if it's something that we know what to do? The thing that we know what to do a little bit more with are our traditional vaccines. What we more traditionally do with the vaccines that you or your children may have received in the past are give parts. So we may give little pieces of the virus that we can expose to your body. We can give very weakened viruses to your body so that the body can then say, maybe I can retrospectively figure out how I can fight this thing without giving it the actual machinery to fight it itself. So this leads a little bit more guesswork for the body to figure out by trial and error what will be the right thing to fight this disease. And the reason why I bring up traditional vaccines is because the Johnson & Johnson vaccine, which is a little bit newer on the vaccine scene as far as it relates to COVID, is a little bit more like a traditional vaccine, a little bit more like your usual flu vaccine. So what we do know, the COVID-19 vaccine is safe and effective. The Pfizer vaccine uses mRNA technology. Because it uses mRNA technology, it has to be kept really, really cold, almost like in sub-degree temperatures, like negative 40-degree temperatures, require special freezers. It is 95% effective at preventing people from getting severe illness or from dying from COVID-19. The Moderna vaccine is 94.5% effective at preventing people from getting severe illness or dying from COVID-19. It is also using mRNA technology, uses very cold freezers to keep these things stored. And both the Moderna and the Pfizer vaccine require 2 doses so that your body can make its own fighting agents. That's the goal of those vaccine using this machine that we've incorporated into the body. The Johnson & Johnson vaccine, also known as the Janssen vaccine, is a little bit newer. It's 85% effective in preventing severe illness from COVID-19. And like I mentioned, it's a little bit more of a traditional vaccine. So similar to the flu vaccine, you receive 1 dose. We don't require these specialized freezers to keep them cold. And so for certain places in the world and in the country where it's near impossible to store things like the Pfizer vaccine or the Moderna vaccine, the Johnson & Johnson vaccine is a great option. Requires 1 dose. And although a lot of people can be taken aback by the fact that it's 85% effective versus the 95 and 94.5 effectivity of the Pfizer Moderna vaccine, what we do know is that according to the CDC and the FDA and these studies in of themselves, they prevent severe illness and hospitalization. Who should not receive the vaccine? Children less than 18 years old. And the simple reason is no one's tested it in children less than 18 years old. Actually, let me be a little bit more specific. The Pfizer was done in children 16 and 17 years old, but right now in the US, most states are not promoting giving these vaccines to children. They just haven't been tested enough. The other group are those people who have severe allergies to the contents of these vaccines. And that doesn't mean people who just have simple allergies. These are people who require things like EpiPens, people who found themselves hospitalized, people who have found themselves requiring medical intervention because of allergies. But this is pretty amazing because we have a vaccine that has proven to be safe in people who are immunocompromised. We found a vaccine that has been proven to be safe in people who have chronic diseases. And these are the groups of people who are at highest risks of dying from this illness, COVID-19. So one thing that I would like to impart on you that is of utmost importance regarding the COVID-19 vaccine is keeping in mind the goals of these vaccines. And sometimes it can get a little bit lost when we're reporting about these type of things. The major goal of giving out the COVID-19 is to decrease death and to decrease hospitalizations, eventually hoping to decrease the spread of the virus. And all of these vaccines, all three of these vaccines have proven that unequivocally, that they have decreased death and dying and hospitalizations that are due to COVID-19. What they are not meant to do are to immediately decrease the spread of the virus. That is why there is still mandates regarding masks. There's still mandates regarding social distancing. Eventually, we hope that the spread will decrease as we start to get to herd immunity. But right now, the goal is not to immediately decrease the spread, but to prevent death and dying as far as it relates to these vaccines. Also, the goal of the COVID-19 vaccine is not to decrease all sickness. Notice I'm using terms like death, dying, hospitalization. The vaccines have proven safe and effective in preventing death, dying, and hospitalization, not necessarily to decrease all sickness as far as it relates to COVID-19. And that's where we start to see some of the numbers in the 95 and the 94.5. Yeah, there are some people who did get COVID-19 and there are some people who did get sick, but thankfully the numbers of people who were dying and had severe illness requiring hospitalization severely dropped as people were receiving the COVID-19 vaccine. So I'm going to hand it over to Dr. Hill.
Thank you, Dr. Kosoko. Next slide, please. Okay, so I'd like to share with you some data on vaccine hesitancy. We realize that there is some concern in the community with how fast the vaccine became available with the emergency use authorization. And there is some evidence of mistrust with the public in the United States. There was a survey that showed 35% of adults were unlikely to get a COVID-19 vaccine. This included 19% who would probably not get vaccinated and 16% who stated they would definitely not get vaccinated. The same survey also found that 51% of vaccine hesitant adults trust their healthcare providers for information about the vaccine. So we perceive this as hope that we can overcome the vaccine hesitancy that currently exists. Next slide, please. So getting the vaccine, making the decision to get the vaccine or not get the vaccine is not something that has only individual level repercussions. There is a societal and social cost of vaccine hesitancy. We know that health disparities to already marginalized communities exist and have been widened by the COVID-19 epidemic. We've seen higher rates of COVID-19 in marginalized groups. We've seen higher rates of severe illness due to COVID-19 in these same marginalized groups, and higher rates of death due to COVID-19 in already marginalized groups. COVID-19 deaths among Black and Latino Americans are 2.8 times higher than COVID-19 deaths among white Americans. Next slide, please. So we want to have a better relationship between vaccine hesitancy and health equity. We want to move the population towards health equity, which will require more people to get vaccinated. Achieving herd immunity against COVID-19 requires that a substantial amount of the population gets vaccinated. So we know with the immune system, every individual has an immune system that protects their individual body from bugs, like Dr. Kosoko said, different types of viruses, different types of things that may threaten one's life. Well, herd immunity is something that we have collectively, where our immune systems work together to protect and preserve human life. And in this case, with COVID-19, that has obviously threatened human life all over the world, it's important that we utilize the vaccine, we get vaccinated so that we can establish herd immunity. Vaccine hesitancy and unwillingness to get vaccinated makes it difficult for us to achieve herd immunity. It's important that healthcare providers and health systems work together so that we can overcome historical reasons for medical mistrust and make sure that underserved populations get vaccinated. We saw in the previous slide that there's a disproportionate burden to already marginalized populations. So it's important that as a people, in order to achieve health equity and for those individuals that have less risk, all people must come together so that we can establish herd immunity. And there needs to be transparency. I see some of the questions in the chat already. It's important that healthcare providers like Dr. Kosoko, public health professionals, that we come together in settings like this so that we can share accurate information in a transparent manner so that some of the reasons for vaccine hesitancy can be eliminated. We have to move people towards vaccine acceptance and adoption. And we know that this will move our society towards health equity. Next slide, please. So what is vaccine equity? Well, this means that everyone has an equal chance of gaining access to the vaccine. There's been different phases, elderly, people with chronic health conditions that were in line first. And now the vaccine is being distributed to a more wide group of healthy individuals and educators so that we can achieve herd immunity. It's important that vaccines are available at no cost, and to my knowledge, they have been at no cost to this point. The vaccine needs to be widely available and broadly distributed. Everyone makes a decision to get the vaccine based on the same set of factors. Is the vaccine safe? Is it effective? And does it offer health benefit? Does it preserve life? Next slide, please. In order for us to get back to normal, however we identify normal, getting vaccinated is going to be a key part of that. Some of the other important measures will be preventing the spread. We know that the COVID-19 vaccine is safe and effective at preventing severe illness, hospitalizations, and death, but we are not certain, we don't have the data yet to know for sure that it prevents the spread. Until we have that data, it's important that we get tested, especially if we feel like we've been exposed. Again, to get vaccinated, it's important that we wear a mask and that we wash our hands. And when we do so, we do it for 15 to 20 seconds every time, and to practice physical distancing. Initially, it was recommended that we stay 6 feet apart, and that has since been reduced to 3 feet. Health communication is also a key factor to getting back to normal. Health information must be shared in layman's terms using words that we use in everyday language so that all people could possibly benefit from understanding the pros and cons of getting the vaccine. And that's why we're here today. We also want to make sure we have community involvement, and we have to talk to one another in settings like this, where we have shared values, understanding, and hesitancy has been established. Next slide. So moving forward, how do we get back to normal? There's been recent news that we are already seeing benefits of vaccine uptake. The risk of transmission appears to be minimal among those who are fully vaccinated, and this allows human interaction to be safer. Recently, the CDC announced that if you've been fully vaccinated, you can gather indoors with other people who have been fully vaccinated without wearing a mask. It's every individual's choice whether or not they've been fully vaccinated and they know for sure that other people have been fully vaccinated to choose to wear a mask or not. For me personally, I still wear a mask because I'm highly risk averse. However, it's important to acknowledge that the CDC is recommending that this is potentially safe for two people who have been fully vaccinated to be in the same room without the mask, and note that the chances of transmission is very small. And this is evidence that we are in a position where we can move back to normal as long as we get fully vaccinated. Vaccines are being more readily available to lower risk groups. And I mentioned this earlier, how we're seeing broader dissemination and broader availability to healthy individuals. I noted something here, this is a Texas reference, but I'm sure they have information like this for New York. But here in Texas, we are now seeing vaccines become available to our educators. Next slide. And that will be it. So we will transition to Q&A.
Great, thank you so much for that thoughtful educational presentation. We're going to transition to some questions. The first one, this idea of emergency use authorization. I was wondering if you could speak a little bit more to that. I know that it can trigger some alarms for some people.
Sure, would you like me to start?
Yeah, whoever would like, yeah. Okay,
so when you hear the words emergency and put with the word authorization, of course, it can sound very alarming. But the big things to think about when it comes to the COVID-19 vaccines are that people have been doing the work in the background for a long time before people even knew that COVID-19 was a thing. There were other viruses called coronaviruses. There are other things called SARS-CoV, and there are researchers around the world who have been working towards vaccines for these things in the background. There's just no reason for the majority of us to ever have thought about it. Unfortunately, in 2020, when COVID-19 infections were declared a pandemic, we had a choice. I'm glad that we and world leaders had the choice and made the choice to say, this is priority number one. That is what emergency use authorization means. It means that we started to funnel resources into these investigations that were already going on. It meant that we were funneling resources, we're funneling money, we were funneling press so that these things could be pushed forward. And rather than putting the usual hurdles in the interest of capitalism for some of these things to move forward, emergency use authorization, EUA, allowed some of these things to go through more expeditedly because this is such an important thing for people worldwide. So that would be the gist of emergency use authorization, saying this is a priority, let's all band together and make it happen. Dr. Hill?
Okay.
Yes, and I'd like to add a little context to the regulatory process for getting things approved through the FDA. There are several different departments, and there's something that a lot of us researchers like to refer to as red tape, because it just seems like hurdles for no reason. And when there's an emergency, it's like the hurdles are laid down so that we can get to the outcome that will protect human life. There are bodies, and when I say bodies, I mean like review boards and committees and steering committees that are responsible for making decisions that preserve human life. So when we have a threat like a pandemic, people rally together, they make sure that there's as few barriers as possible to protect the public. And that's what happened with the vaccine. Those hurdles were taken out of the way. There were no shortcuts. It's just that the process was made clearer and more smooth so that we could achieve the outcome that we really needed, which was a vaccine to preserve life.
I will also add in this, a lot of people will say it's too fast. It happened too fast. And one of the things that I would say to that is shame on us, because in theory, most of our medical breakthroughs should be happening that fast. But we put up a lot of artificial barriers. We don't fund things that should be funded. And what we saw in 2020 was when we actually put in the work to move things forward, we can be successful. And unfortunately, we've all just gotten used to and complacent with, well, it kind of takes 10 years for these things to happen. But that's because of a lot of artificial hurdles that are placed in front of researchers, a lot of monetary hurdles, a lot of governmental structures that choose to prioritize other things. So it is actually an incredible feat of humanity to say, when we put our resources where they need to be, what we can come up with.
Great. Thank you. Thank you for those responses. The next thing I wanted to talk about is you touched a little bit on the distinction between Johnson & Johnson versus Moderna and Pfizer. And I was wondering if you could elaborate a bit on, I know that there were sort of specific contexts in which those those were pushed out, and they have different numbers in terms of their effectiveness. And I was wondering if you could speak to that. Dr. Kosoko or Dr. Hill.
Sure. So it's interesting because I do try to keep my finger on the pulse of pop culture, in addition to the actual news. But even the actual news, if you're not necessarily getting the scientific, as opposed to the more sensational point of view, how interesting the information can be skewed. So plainly said, all three, all three vaccines are equally effective at the goal, which is decrease hospitalizations, decrease severe illnesses, decrease deaths. When we start talking about things like efficacy and some of the percentage points that start to come out regarding the 95, the 94.5, the 85, and some of y'all have probably even seen like 66%, those are starting to get into the scientific methods. And things that we need to keep in mind when it comes to scientific methods is, if you're not going to read the whole study, it is faulty for you to pick and choose what you're going to take out of that study. For example, the Pfizer was the very first one to get approved. It was also done at the very beginning of the pandemic with a certain population. The Moderna was done a little bit later than that. The Johnson & Johnson wasn't done until about last winter. Around October, November. So some of the numbers that we've come up with for the efficacy, 95, 94.5, have to do with the populations that we're studying. The Johnson & Johnson was a little bit different. What we found with the Johnson & Johnson is some of the reasons why the numbers were a little bit lower in terms of people catching coronavirus is when it comes to scientific methods, there's certain shifts and drifts. So the Johnson & Johnson vaccine was looking at a different population. It had more international, outside of the US, I should say, folks involved. It's dealing with a different time period. It's dealing with a different population. So its methods were a little bit different. But at the heart of it, answering the question of the study, did it do what it said that it was going to do? Decrease hospitalizations, decrease severe illness, decrease deaths. It did that. I hope that answers your question.
Yeah, it does. Thank you. We got a question here. If the vaccines work, why do we still need to wear a mask and social distance after being vaccinated?
I'd like to answer that question. So like Dr. Kosoko said, the vaccine works at preventing severe illness, hospitalizations, and death. It remains to be seen if the vaccine prevents the spread and prevents transmission or someone being able to contract COVID. So I'll use myself for example. I'm fully vaccinated. However, I have 2 children in my home who are under the age of 18 or 16 for the Pfizer vaccine. They are not vaccine eligible. So I'm fully vaccinated. Let's say I go out without my mask, I contract COVID and I don't get sick because I'm fully vaccinated. The data does not prove that I can't transmit that to my children. So there's still a risk because they have no protection and I'm fully protected. The same could be said for your grandmother, for your uncle, brother, sister, anyone. So in order to protect those that we love and care about, it's important that we continue to wear our masks.
And the interesting part is the more people who are vaccinated, that's where we get herd immunity. The vaccine loses a lot of its power because a lot of us have enough of the tools to fight this virus so that it loses its power, even in the more vulnerable of our populations, even in those who can't get the vaccine themselves. So remember, the goal of the vaccine right now immediately isn't to decrease the spread. Eventually will be to decrease the spread as more people get the vaccine. But in of itself, it cannot promise to do that. Only our variations in behavior can do that.
Great. Okay, thank you. I was hoping you could also speak to pregnant or nursing. Is there data on if mothers are pregnant or nursing, if they can receive the vaccine, if there's any concern there?
Yes. Right now, the only people who should not be getting the vaccine because they're not approved are children. And 2 are patients who get anaphylactic severe allergic reactions. And that's an amazing thing. I have several colleagues who are nurses and physicians who are pregnant, who are nursing, and who have received the vaccine because they have deemed that it's going to be the best thing for them and their families. Remember that these vaccines aren't altering DNA. They can't alter your child's DNA. There have been no studies or no reports even that breastfeeding mothers can transmit anything negative due to this vaccine to their breastfeeding children. There might be studies even in the future that these moms, the same way that they tell you to breastfeed to help transmit good antibodies to your children, down the road, it might actually be found to be protective. We don't know that now, but that's one of the hopes. I know initially there were some concerns that for pregnant women that it could potentially cause some fetal defects, or that they could potentially cause some neurologic problems. But no studies could show that any children who have actually had any of those issues had it causatively due to these vaccines. But again, going back to how the vaccines work, it would be very unusual. And I should emphasize that the major components of these vaccines are the mRNA or the protein, the sugars and the salts, and some lipids, which are fats. And those are just things to help sustain them while they're on the shelf and to make them still viable while they're going into the body. So not really anything else that is too interesting that it's going into these vaccines. But yes, safe for pregnant women, safe for lactating women, safe for the infants who are receiving the breast milk.
Great, okay.
I do want to mention something. I don't have the reference, but I remember seeing an article that a mother who had been vaccinated gave birth to a baby with the antibodies. And it was the first case where they saw that the baby actually had antibodies to COVID because the mother had been vaccinated. So I don't know if that's going to be a trend or if that was an isolated event, but it was definitely promising.
Interesting. That actually brings me to another question that came in the chat. Does the vaccine cause you to produce antibodies? If so, why do people who have natural antibodies as a result of having had the virus, why do they still need to get vaccinated?
That's a really good question, because there were a lot of people who, when they got the vaccine, when they got the illness, and they lived through it, the next thought is, yeah, I'm good. Kind of. The next issue is, how long do these antibodies last? And we simply do not know. So is it going to be the type of thing that we're going to need yearly? Partially because the virus is mutating like we do with the flu shot. Is it going to be like the virus is not mutating that much, but you need a booster, kind of like your measles, mumps, rubella, or chickenpox? Those don't change that much, but your body runs out of antibodies at some point. We don't know the answer of how long these antibodies last. And so simply, I don't think anybody can tell you with good faith at this point. Hopefully we'll know in a few years.
Got it. Right. It's still so new. There's still so much developing. Another question here. Are the vaccines still approved just for emergency use, or have they been like long-term approved? I'm not sure if that's clear.
Right now, they're still under emergency use authorization. And part of that is not just allowing them to be used, but it's also helping with their distribution. So by declaring it an emergency use, this is how we're able to come up with these huge vaccination programs, getting the stadiums and being able to pay people to do these things, finding volunteers, and using the funding, emergency federal and state funding to get these things done. So it's not just authorizing its use, it's mobilizing the actual implementation of the vaccine. So right now it's still under emergency use authorization.
Got it. Thank you.
I do want to comment because I think a lot of people don't realize that the emergency use provides access to resources that will make distribution unlikely or not feasible without those resources. So it isn't just trying to get it in your arm just because we want to get it in your arm fast. We need it in order to protect our lives as a people. There's been over 500,000 deaths in the last year. COVID became the leading cause of death in 2020. So we don't want that to continue. So that's an emergency.
Yeah. Okay. We will move on to another question. We had a question about concerns if you have blood clotting. Are there any concerns with getting the vaccine?
That was big news about a week or two ago. Yes, that is the AstraZeneca vaccine that's mostly under investigation in Europe.
Mm-hmm.
I don't know all the details about it. The most recent that I've heard is that there isn't necessarily a correlation with the vaccine, but the numbers were higher in some of the vaccine group. But as mentioned, it is not one of the 3 vaccines that is currently approved for the United States. If it is to be approved down the road, however, I imagine it would be because they are able to disprove blood clotting disorder that was drawing people's attention a couple of weeks ago.
Got it. Great, thank you. So what are some of the, and I apologize if you mentioned this before, but what are some of the side effects of the vaccine that have been identified, if any?
Very few. The majority of people are going to tell you, the most common ones are the people who are like, I felt really run down after usually the second dose of the Moderna and the Pfizer. People who just felt really run down, really tired, and felt like they got a really bad man cold. I make fun of some of my male friends. But my biggest complaint was my arm hurt for about a day. And that got better with some Tylenol. But otherwise, there's been lots of concerns. And unfortunately, it's the ones that people that have not necessarily been able to correlate with the vaccine that make the news because they're sensational. But I would like to emphasize, especially for the people who are of the mentality of wait and see, there have been millions of people who've gotten the vaccine at this point. We've gone through the trials. We are about our third wave of people who are getting the vaccines in the country. And in terms of the wait and see, there have been very, very few side effects of the vaccine itself, because as I mentioned, sugar, protein, salt, and lipids. Very rudimentary. I wish it was more interesting than that. The bigger issue of discussion is, are we going to get it or not?
I have another question here. How long should I wait after a positive result to get the vaccine? Dr. Hill, I think you're on mute if you wanted to respond to that.
I am muted. I was saying that's a good question. I hear there is a time frame where they ask that you wait after you've tested positive before getting your first vaccine. What time frame is that, Dr. Kosoko?
Most people would say at least about 2 weeks. It's a type of discussion that one would have with their doctor, but it all goes back to that same, and even 2 weeks, it's an arbitrary thing, but it's what we've all decided. Like even if you remember back in like March of 2020, it's like, even if you have a sniffle, stay in your house 2 weeks. It's pretty much the lifespan that we've given for symptomatic illness for this disease. So usually people will say about 2 weeks. It's the type of thing that you can discuss with your healthcare provider.
Great. And you've touched on this a little bit, but can you expand a little bit on if you've already been vaccinated, you still can contract COVID, correct? Can you just elaborate a little on if there's much evidence saying one way or the other?
Yes, in theory, you can still contract COVID. Whether you're going to be having the same symptoms leading to hospitalization or death, you should not. You may still have some symptoms, mild symptoms, usually things that might last a day or two at max, but they should not be as bad as hospitalization or death. And because some people are going to, if you remember the slide, developing your keys, developing your weapons, developing your tools, some people are going to get very robust resources, tools, weapons. And as soon as that virus enters their body's going to give that virus a 1-2 punch, and they're not going to be transmitting it to anybody. Other people are going to get just enough so they don't get just enough resources in their body that they don't get sick. Other people are going to get just enough that they're not going to get sick and need to go to the hospital. So people can be on that spectrum, but you don't know who you are on that spectrum, unfortunately.
Dr. Hill, you touched on this a bit in your presentation, but I was wondering if you have thoughts on how there can, like the medical community and certain communities can build a greater sense of trust between one another. I was wondering if you have any additional thoughts, because it sounds like it's also very aligned with your career, your sort of intentions.
Oh, yes, it is. I think that the first thing that comes to my mind is making ourselves available. When we have these types of opportunities to speak to the community and share our thoughts, our expertise, our understanding of the scientific information, and translating that into layman terms that's more digestible for the general public, I think it's important that we take those opportunities to do that. I've spoken a lot about COVID prevention, the importance of prevention, why it's important. Just like the example that I gave with someone who's fully vaccinated in company with someone who isn't, and the likelihood of spread, and protecting those that you care about. I think that as humans, we're innately good and we want to protect one another. We don't want to hurt one another. So when we realize that things like getting the vaccine is related to that innate guiding principle, then maybe there will be more openness and willingness to get vaccinated. So I think that is something that the health providers can do. I think also in certain segments of the community, especially marginalized communities, there's been a history of medical mistrust. And I think we need to be able to have those conversations instead of avoiding those topics because it's uncomfortable. So we have to be willing to be uncomfortable, because the intention and the potential fruit of having those conversations could save someone's life.
Yeah,
and I would be dishonest if I were to say that I was not initially on board with the vaccination. And it sounds very two-sided, but when they said vaccination, I said, nope, I am a Black woman, and no, they're not going to get me, which is a shame. I know medicine. I've studied medicine majority of my life, but I also know why people would feel mistrust. Wholly. And even the first round of vaccine signups in our hospital, I've checked, no, thank you. I will wear my mask and I will distance. And I thought about it. I prayed about it. I found myself, if I want to make a change in this world, if I even want to make a change in my family, how can I talk about the risks of the benefits of this vaccine if I don't even get it myself? It was an incredibly humbling experience for me to go and get it. I was scared, and I will admit that. But I can also tell you, 4 months later, the worst part about it was that my arm hurt. And I have not heard anything that would make me say on a national scale that we need to be halting the distribution of these vaccines. So I would like to be completely honest that, yeah, there's reasons why people should be scared. I get it completely.
And I'll since you're being honest, I'll be honest too.
please.
No, initially before I heard the research, the data on the 94.5 and the 95, when they were talking about a vaccine and the data was not there, I was against it as well. But I believe the scientists, I'm a scientist. So I believe, and I looked at the sample size, how many people, okay, is that generalizable? I applied my scientific mind to the findings, and that helped me overcome some of my medical mistrust. I had more than a sore arm after the second dose. I was one of those that was extremely fatigued, but that experience showed me this is why I don't want COVID. Because if I felt like that for one day, I can't imagine experiencing COVID without the vaccine. So I was happy to have that experience. And I also realized the trust that I have in my community, that by being a champion for the vaccine, I showed pictures on social media of myself getting the vaccine. I knew that would help my community to have more trust in the vaccine. And I thought that was very important.
Great, thank you both especially for sharing your personal stories. I think that that's incredibly valuable and interesting. Another question that came in the chat, do we think this will become an annual vaccine expectation?
There's a chance. I don't know. Part of this has to deal with how long do these antibodies actually last? How quickly or severely is the virus going to mutate? Is it going to become more potent? Is it something that we'll all get to the herd immunity? And even if it does have these minor shifts, we use the word shifts and drifts in when we're regarding bugs, is it just going to have some minor drift? Is it going to have some huge shifts? And that COVID-19 is a huge shift. COVID as in coronavirus has been around forever. It just mutated very drastically in a way that we weren't able to anticipate. So we don't know. Could another bug, could a rhinovirus, that's your common cold, could a rhinovirus decide that 2021 is its year, that it wants to do a huge thing? God forbid, but we don't know. We don't know these answers.
Yeah. It's such uncharted territory.
It is. I'm expecting it to mimic the flu vaccine. We get that annually. They adjust it based on their predicted strain of the flu. And I think that the number of cases that we experience nationally, if we can get it down to a certain number, then maybe that won't be necessary. But I think in order to keep it at bay, we probably can expect to need the vaccine, until we can achieve that low prevalence.
Yeah, that reminds me, I heard something from a doctor that compared to the flu vaccine, these vaccines are miracles. Would you agree with that in terms of their efficacy? Like, I heard that the flu is like 50%.
The flu vaccine isn't as good as the COVID vaccines have been showing right now. And then the technology is very different. And the biggest thing is the technology can change the way that we move about vaccines in the future.
Great. Well, thank you so much. That was incredibly informative, and we really, really appreciate it. I'm going to hand it back over to John as we approach time.
So Dr. Hill, Dr. Kosoko, I want to thank you both for sharing your wisdom, your scientific knowledge, your opinions with us here today. Joey, excellent moderation on your part. Thank you. I also want to thank our 40+ participants, again, many parents, a number of staff. We got tons of questions. So if we didn't answer your question, it isn't because we didn't want to, it's because we only had an hour tonight to get through some of them. We've also copied all the questions. I think several of us have. I know I have them now in a Google Doc. And so we're also going to do our best. No promises here because I don't want to, we don't know if Dr. Hill and Dr. Kosoko will be able to help us with this, but we want to try to get specific answers to your specific questions as best we can. We know there's a wide range of opinions about the vaccines. We've done our best, again, to be guided by the evidence as educators, to work with scientists and public health officials. We know some of you disagree with the things that have been shared tonight, which is you're right. We're going to continue to make the best decisions we can make as educators, as managers, as a system of public schools. Again, I want to thank you all. We really have a lot of respect for our presenters tonight, for each of you, and all the hard decisions that we're all making. Our position, again, is for those who are eligible for these vaccines, we strongly encourage you to get them. Again, Dr. Hill, Dr. Kosoko, thank you both so much and wish everyone a terrific evening.